Technologies. So first, I would like to introduce Dr. Roshna, who will be talking on laser procedures, introduction and consent. Dr. Roshna is a consultant, glaucoma consultant at We Trust Eye Hospital, Calicut.
Thank you for the introduction. Thank you for this opportunity, Dr. Nimita. My topic is introduction and consent to laser procedures in glaucoma. So, what is the importance of laser light? Laser light, when compared to incandescent light, it is monochromatic, it is directional and coherent. The laser journey started from the 1961 by Campbell and Riddler. They used for retinal photocoagulation, and in 1962, laser used by Worth and Wickham for the anti-tubercular meshwork. And 1962, the Krasnov introduced the laser iodotomy. 1972, Becker and colleague introduced the ALT, argon laser trabeculoplasty. In 1990s, diode was introduced for refractory glaucoma. In 2000, Latner Park introduced the SLT, and in 2010, micropulse diode laser was introduced. Lasers used in glaucoma is argon blue green and green laser, and diode laser, ND-arc laser, and carbon dioxide lasers. What are the type of lasers? We have gas lasers, chemical lasers, solid state lasers, metal vapor lasers, and semiconductor lasers. What are the mechanism of lasers in human tissue? First important mechanism is the photodisruption that is used in the ND-arc laser. This high energy light is deposited over a short interval to a target tissue, and there will be a striping of electrons, and these electrons will form a cloud, and ionized molecule constitutes a plasma, which then rapidly expands and causes a acoustic shock wave that disrupts the tissues. That is used in the ND-arc laser, peripheral iodotomy. The next important mechanism is the photocoagulation. Absorption of light by target tissue results in temperature rise, which causes denaturation of proteins that is used in the argon laser and tryptophan lasers. And next important mechanism is the photoablation. When high energy laser wavelength in far ultraviolet region of spectrum is used to break the long chain tissue polymers into smaller volatile fragments that is used in XMR lasers. And another important mechanism is the photochemical or biostimulatory effects that is used in a micropulse mode or lower level laser therapy to modulate the inflammation or metabolism, and they will induce the biochemical changing cell through cytochrome oxidase activation and reactive oxygen species that is used in the micropulse diode laser. What are laser procedures in glaucoma? First important thing is the laser peripheral iodotomy, that is producing a hole in the peripheral iris, and fluid is maintained between the anterior and posterior chamber that is used in the angle closure glaucomas. Next one is the laser iridoplasty, that is circumferential 360-degree laser is applied to the peripheral iris, and the peripheral iris is pulled away from tubercular meshwork that is in the apposterior angle closure and plateau iris and ophthalmos. Next one is the laser tuberculoplasty that targets the tubercular meshwork in the anterior chamber to improve the aqueous outflow. And laser suture lysis, the suture is lysed with the laser after in post-operative mechanism, post-operative setups. And in laser blood remodeling, it can be performed to treat the problems like filtration and leaking or large encapsulated symptomatic blood by using a laser to shrink or modify the blood structure. We are using a NDR or argon laser for this. And laser synecholysis is to prevent the adhesion between the iris and lens capsule. Laser is used. Then next is the laser cyclophotocoagulation, the destructive laser procedure done to the ciliary pigment epithelium to reduce the aqueous humor production in refractory or end-stage glaucoma. There are different types of cyclophotocoagulation: transclear, endoscopic, and micropulse. We are coming in detail to each and every session in next sessions. Okay. Next important thing in the every laser procedure is the consent. So the consent form should start with the patient identification. The name, age, and hospital or clinic number should be written in the consent form, and the eyes to be treated should be mentioned. And next, we have to describe the procedure. We have to clearly describe the procedure in lay terms. For example, laser treatment to the drainage area of the eye to lower the eye pressure. And the laser peripheral iodotomy, we have to mention it as creating a hole in the iris to create the increase the fluid flow. And laser trabeculoplasty, that is treating the drainage meshwork to improve the outflow. And laser cyclophotocoagulation, that is reducing the aqueous production by treating the ciliary body. And in lay terms, we have to mention like this. And the next important thing is the purpose and indication. Explain why the procedure is being recommended to lower the IOP, to prevent the slow progression of optic nerve damage, and to avoid or delay the need of surgery. Then we can also explain the expected benefits, that is reduction of IOP, possible stabilization of glaucoma progression, and short recovery time as compared to the surgery. And we have to mention about the details of the procedure. That is, usually it is a OP or OT procedure done under topical or local anesthesia, and duration of the treatment, pupil dilatation or constriction needed, and possible temporary discomfort or blurring of vision or light sensitivity we have to mention. And the risk and possible complication we have to mention. It will be specific to laser type, but generally it include eye irritation, pain and headache, transient blurring of vision, inflammation requiring the additional drops, and temporary or permanent rise of falling IOP we have to mention, and need of repeat treatment or further surgery also we have to mention. Specific to each laser, in laser peripheral iridotomy, we have to mention about the glare, halos, and double vision, and bleeding at the iris and closure of iridotomy chance we have to mention. And SLT and ALT, IOP spike, failure to reduce the pressure, rare but permanent damage to trabecular meshwork also should be mentioned in the consent form. And in the cyclophotocoagulation, we have to mention about the inflammation, hypotony, vision loss, shrinkage of the eye, phthisis also we have to mention. And in the case of diacyclic photocorrection, surgeons should warn the patients about the postoperative pain and some reduction of vision. And more than one CPC session, we needed to achieve the desired control of IOP, we have to mention. And we have to mention about the postoperative care and use of anti-inflammatory and pressure lowering drops, and possible need of follow-up IOP checkups we have to mention, and avoid rubbing of the eye, and report if there is severe pain or blurring of vision. And the prognosis and limitation, we have to mention in the consent form. Laser may not eliminate the need of AGM, anti-glaucoma medications, and effect may bear off over time, especially in the case of SLT. And repeat treatment we have to mention. And the consent of acknowledgement, patient should sign to confirm, and patient and bystander signature should be there like this, and the doctor declaration should be there, and the physician name and signature should be there, and the witness's name and signature should be there in the consent form. And we have to take consent for the optional clause for any permission of the photographs or data use, and consent for emergency management of complications. And there should be a closing statement. It should be like this: I understand that the laser treatment for glaucoma is intended to lower my eye pressure and help prevent further vision loss, but it may not improve my current vision or eliminate the need of medication or surgery. Thank you.